Just in here, the doctor will see you.
Good evening, Mrs. Jones.
Hi.
Hi. How can I help you today?
Yeah, it's my back. It's been driving me mad. Just wondering if there might be an operation or something I could have.
We talk about options later on. Would you tell me a bit more about your back pain?
Yeah, I sort of, heard it at work a couple of years ago, and it just hasn't got any better. It just, feels pretty bad all the time.
How did it happen?
I'm a nurse, so
Yeah.
I was helping a patient and I twisted it,
Hmm.
and then I've been on, desk duties ever since. So
Oh, that would be hard.
yeah,
You must be at pain most of the time.
yep,
Mm.
all the time.
Mm. And where is the pain exactly?
Oh, it's in the lower back.
Yeah.
Yeah.
Does it go anywhere?
No,
Any numbness or pins and needles anywhere?
no,
Any problem with your bowels or bladder?
no.
Have you lost any weight?
No, if anything, I've probably put on a couple of kilos.
Yeah. Any family history of cancer?
No.
Have you had your pap smears done
Yep.
regularly?
Yeah, that's all fine.
Have you found anything making the pain worse?
I know when I've been sitting at my desk all day for a
Mhm.
long time that it's worse, and when I'm at home doing stuff with the kids, cooking dinner and stuff, it feels worse then, but the pain's there all the time though.
Anything helping with the pain?
I take painkillers sometimes. Panadol seems to help, and sometimes I've taken Nurofen.
Yeah. Have you seen any doctor in the past? Any tests?
Yeah, when I first did it, I had an MRI and some other tests, and they said there was no disc problems, and it was just a matter of doing exercises and physio. Yeah, but it just seemed to work. It seemed to hurt more, if anything.
How long did you continue with physio?
A little while, but it just made the pain worse. And the doctors never mentioned how's physio going or anything, so it was never. I just stopped doing it.
I'll make sure we monitor you regularly with your back pain.
Yeah.
I'll ask a few more questions and then we discuss about the options.
Okay.
Any other medical condition in the past?
No, I had my appendix out. That was a few years ago.
Yeah.
That's all.
Do you take any other medication other than painkillers?
No.
Do you smoke?
No, not now. I stopped when I was pregnant.
Alcohol?
A little bit, maybe a couple of glasses of wine a week.
Okay. And how's the situation at home? How old are your kids?
My kids are 6 and 9, and look, it's okay. It's hard because I'm a working mum, and then, busy after work, looking after the kids and everything, and then they're a bit sick of me whinging about my back, and my husband's sick of me whinging about it. So, but we're coping okay.
How's your relationship with your husband?
Yeah, it's okay.
Has the back pain affected your sexual activity?
Yeah, I guess we're not having sex as much as we used to because I am in a lot of pain a lot of the time.
Look, from what we discussed, it seems to me operation is not a good option for you for the type of back pain you've got, because it's not nerve damage related. What's your feeling about that?
Oh, that's what I was told initially, so I guess,
That doesn't mean we can't do anything about your back pain. You mentioned about physio. Did you try anything else?
Look, yeah, I tried swimming, and that was helpful, but it was a bit hard to get to the swimming pool, and with the kids and everything, and with work, it's difficult.
Is there any way we could make it a bit easier?
Well, I guess they're a bit older now, so I could take them to the pool with me. I could ask a friend to look after them a couple of days a week.
Yeah, that's a good idea.
Yeah.
Do you think your family would be supportive of that?
Yeah, anything that'll stop me from whinging, yeah, I think so. I was going to try Pilates, but I think that's a bit expensive.
Pilates can be helpful, but a good physio program which can help to strengthen the muscles around the spine and also your abdominal muscles can be as effective as Pilates. Yeah, what do you think about what we discussed today?
So there's no magic bullet or something? Like, maybe?
Yeah, unfortunately, yeah, there's no such a thing. But I'm optimistic with physio and swimming. We can improve your mobility and reduce the pain.
Yeah.
And yeah, so I'm going to make a referral to the physio.
Yeah, there's a physio, there's a clinic at work where there's a physio, so I could probably make an appointment to go there.
Yeah, that's a very good idea. And I'll book you to see you here in 2 weeks' time to see how's been your progress.
Yep.
Anything else I could help you today?
No. Thank you anyway. Yeah, no, that's all good. That's good.
Yeah.
All right, thank you.
No worries. Good.
Okay,
See you.
thanks. See you later.
Bye.